My name is Bilal Barkatali. I'm a consultant specialist knee surgeon here at the Alexandra in Manchester. The time to be considered for a knee replacement is when the joint becomes very degenerate and dysfunctional, usually secondary to severe osteoarthritis of the knee. A knee replacement works by trying to mimic the human knee joint. The human knee is removed during surgery, and a metallic prosthetic knee is used to replace it. Traditionally, the knee is assessed using X-rays, and a decision is made to proceed to surgery. And during the operation, physical measurements are taken to decide how much of the knee should be removed and from where, and what angles and rotational alignment of the knee replacement should take place. Using robotics, we use a CT scan, which gives multiple times the number of images, a much higher degree of accuracy when deciding how much bone to resect, and a much more accurate placement of the implant when the prosthesis is implanted into the body. So the main advantages for patients using robotic knee surgery is that it's done through a smaller incision. It's more accurate, there's less trauma and damage to the patient's own tissues, resulting in less bleeding, less pain, quicker recovery, and therefore less time spent in hospital and earlier discharge to home. The recovery after the operation is shorter than a manual knee replacement, and usually the patient is only in for one night after the surgery, and sometimes can be discharged on the same day. And usually the time to recovery to full activity is around 6 weeks. If you have any more questions about this procedure, leave a comment below or book an appointment with a consultant at circlehealthgroup.co.uk.